Hello, dear friends. I am with you, Sofia Durinskaya. I am a doctor, a psychiatrist, and the director of the Sofia Durinskaya Medical Information Center. Today, I decided to give a simple vitamin regimen for people who suffer from gastritis. Unfortunately, neither doctors nor patients are currently aware of conditions such as hypo and avitaminosis, and the treatment of the pathology becomes ineffective. Let's look at what causes can lead to gastritis. And in general, what is gastritis? Gastritis is inflammation of the inner lining of the stomach. It can be caused by several reasons. It can be due to hypersecretion of hydrochloric acid. It can be due to hyposecretion of hydrochloric acid. It can be caused by eating spicy and irritating foods. This condition can be the result of either an incredibly intense and overwhelming level of acute stress, or a long-term debilitating period of chronic exhaustion and pressure. In any case, when a person eventually gets sick and seeks professional medical advice from a healthcare provider, they naturally want to receive the kind of comprehensive help that will empower their own body to become the primary cause of overcoming the disease. And ideally, the person would be fully restored to health and completely liberated from their underlying pathology. Let me tell you today some fairly simple techniques on how to behave in various situations so that your body can cope with the situation, become the cause of a superior state, and be able to overcome the illness. So, if a person has reduced secretion of hydrochloric acid, in this case, certainly, and if this has led to inflammation of the stomach, gastritis, the first thing needed here is a diet. The food should be very well cooked. The food should not be tough at all, but extremely tender. When you are sitting down to eat, you should make sure to chew every bite of your food very thoroughly. In other words, no poorly chewed pieces of food should enter your stomach, and your meals should be fairly frequent. There should be no irritating foods in your diet, and you should follow the vitamin regimen that I will mention at the end of the video. If you have increased secretion of gastric juice, you should also follow the general guidelines here. You need to maintain a proper balance between work and rest. Frequent meals are very beneficial. All of your food should be thoroughly and carefully chewed. And you should strictly exclude a wide variety of different spice additives that are known to stimulate the secretion of gastric juices. And follow the vitamin regimen that I will mention later if your doctor prescribes it during an exacerbation or in the acute stage of gastritis. Antacid medications are drugs that reduce the secretion of hydrochloric acid. The first thing you need to understand, both patients and doctors, is this. First, the period during which these medications are prescribed should be limited. That is, to relieve pain and somehow soothe the stomach lining. At the same time, all the conditions remain. You must chew your food very thoroughly, eat regularly, and the food should be neither cold nor hot, and should not contain any spices or ingredients that irritate the stomach lining. But the period for prescribing antacid medications is always very short. Why? Because if you block the production of hydrochloric acid, then this is guaranteed. It will lead a person to severe vitamin deficiencies and to a very long, agonizing death. Vitamin deficiencies are life-threatening conditions. Please remember this, or recall it if you once knew and have forgotten. So, what vitamin regimen should be followed even during the acute phase of gastritis? And why is it necessary? Because the body cannot become the cause of a condition when it lacks resources. If, in general, you eat very poorly, if you eat rarely, and if you have hypo or avitaminosis, your body, the human body, does not have the resources to cope with an acute critical situation it finds itself in. That is why, when this acute critical situation arises, excluding vitamins from the treatment regimen is absolutely not recommended. Without including vitamins in the treatment regimen, the human body will never be able to cope with an acute critical situation. So what should the regimen be? If you are in an acute phase, even during the acute phase of gastritis, it is essential to take vitamin B3 or nicotinic acid. Why? I'll explain. Some might object now, saying that everywhere it is written that nicotinic acid increases the secretion of gastric juice. But I want to say that nicotinic acid is not a medication created to increase the secretion of gastric juice. Nicotinic acid is an absolutely essential vitamin for the human body. A deficiency of it causes dysfunction of the gastrointestinal tract. This dysfunction can manifest as either decreased or increased secretion of hydrochloric acid. Therefore, adding nicotinic acid in doses that do not significantly increase gastrointestinal secretion is completely justified, even in cases of gastritis. Well, maybe the first or second day while the pain is severe, while it subsides, and you don't need to. Although, to be honest, my recommendations to people who wrote to me were, even when things are really bad, you take a tablet, break it into tiny pieces, and even with just a spoonful of food, maybe, I don't know, some thick kissel that you can eat, you add that tiny piece of nicotinic acid and eat it. I can say that in a very severe situation with constant vomiting, when doctors couldn't find the cause, they had already done CT scans, were even suspecting a brain tumor, but no. So, when all the serious conditions had been ruled out, this addition of tiny bits of nicotinic acid brought the person back to normal within a week. That's why I can say with absolute certainty that if you are experiencing a gastritis flare-up, nicotinic acid is the answer. Just a tiny amount, 2 to 12 milligrams, which is a quarter of a tablet. In principle, you can even divide it again into an eighth. If that's physically possible, you definitely can. You should add it to the amount of food you eat, because nicotinic acid is a vitamin that is responsible for the normal functioning of the gastrointestinal tract. Look at the signs and symptoms of nicotinic acid deficiency, and you'll see constipation, diarrhea, flatulence. All of these indicate that the gastrointestinal tract is in a state of dysfunction or impaired function. So what is our protocol? For the first 6 days, you take the following. Vitamin B3, 12.5 milligrams, a quarter of a tablet in the morning with food, and 12.5 milligrams, a quarter of a tablet in the afternoon. And 2 tablets of magnesium plus B6, with each tablet containing 48 milligrams of magnesium. Here you take it in the evening, 1 hour after eating for the next 6 days, half a tablet each time. In the morning, half a tablet. In the afternoon, 4 tablets of magnesium plus B6. In the evening, 1 to 1.5 hours after eating, and for the final 6 days, it's 1 tablet of 50 milligrams. In the morning and afternoon, as per the instructions, 6 tablets of magnesium plus B6, 1 to 1.5 hours after eating. These arrows indicate that if, during the process of transitioning your dosage to an increased regimen, you experience any physical discomfort, then you should immediately revert back to the previous lower level and remain on that setting for a while longer. Stay on it for another 6 to 10 days, depending on how you feel, and then you move up to the increased regimen again. If everything is fine here, after 6 days, you move down to a higher regimen. If you experience any discomfort here, you move up or move up to this level. In other words, here you assess your condition and act accordingly. And dear colleagues, dear patients, I want to say that knowledge about the state of hypo and vitaminosis, understanding the underlying causes of inflammatory processes, and knowing which vitamin to include in each specific case will make your treatment effective, your patients grateful, and you will feel very confident throughout the treatment process. This was Sofia Dorinskaya with you. All the best. Goodbye.